A new coronavirus, designated 2019 nCoV, was identified during December 2019 in Wuhan, Hubei province of China, after people developed pneumonia without a clear cause which did not respond to typical treatments. The rate of spread of the virus has increased since mid-January, with several countries outside China reporting cases. There is evidence of human-to-human transmission. The time from exposure to developing symptoms is about 2 weeks and the resulting disease can be fatal. Chinese scientists were able to quickly isolate a strain of the new coronavirus, with the genetic sequence being made available for laboratories across the world to independently develop PCR tests that can confirm infection in a person. Of the first 41 people confirmed by real-time RT-PCR and next-generation sequencing to have been infected, 2/3 are found to have a link with the Huanan seafood wholesale market, which also sold live animals. The 7th member of the coronavirus family to infect humans, 2019 nCoV's genome sequence has been reported to be 75 to 80% identical to SARS-CoV, and more than 85% similar to several bad coronaviruses. Whether this virus is of the same severity or lethality as SARS is unclear. Chinese Premier Li Keqiang has urged efforts to prevent and control the epidemic. Wuhan has been placed under quarantine, in which all public transport and IDAD has been suspended. Thereafter, transportation in at least 15 other cities in Hubei province have also been halted in a similar fashion. Many New Year events have been closed over fear of transmission, including the Forbidden City in Beijing, traditional temple fairs, and other celebratory gatherings. Hong Kong has also declared a state of emergency, closed its schools and universities until mid-February and cancelled its New Year celebrations. The World Health Organization, WHO, decided against declaring the outbreak a public health emergency of international concern on January 23, 2020, but said that their emergency committee would reconvene to review the decision if necessary. The WHO had previously warned that a wider outbreak was possible, and there were concerns of further transmission during China's peak travel season around the Chinese New Year, Chunyun. An increase in the disease since late January has raised questions relating to its origin, wildlife trade, the virus's ability to spread and cause harm, whether the virus has been circulating for longer than previously thought, and the possibility of the outbreak being a superspreader event. The WHO was notified of the first suspected cases on December 31, 2019, with the first instances of illness appearing just over 3 weeks earlier on December 8, 2019. The Huanan seafood wholesale market was closed off on January 1, 2020, and people who showed symptoms of the coronavirus infection were isolated. Over 700 people, including more than 400 healthcare workers who came into close contact with possibly infected individuals, were initially monitored. After the development of a diagnostic PCR test for detecting the infection, the presence of 2019 nCoV was confirmed in 41 people in the original Wuhan cluster. Of those 41 people, 2 were later reported to be a married couple, one of whom had not been present in the marketplace, and another 3 were members of the same family that worked at the marketplace's seafood stalls. Extensive testing thereafter revealed over 2,000 confirmed cases in China, some of whom were working in healthcare. Confirmed cases have also been reported in Thailand, South Korea, Japan, Taiwan, Macau, Hong Kong, the United States, Singapore, Vietnam, France, Nepal, Australia, Malaysia, and Canada. The first confirmed death from the coronavirus infection occurred on January 9, 2020. By 25th of January, the number of deaths due to 2019 nCoV stood at 56, all in China. Here is the chart of the casualties. Make sure you subscribe to our channel for more updates on the virus disease.